Hello there, now Dr. Brownhilda Santo don't come again today. We will talk about another important topic where most people they don't get them at one point or the other for their life, or they will get them. Today's topic will be now about cough, and specifically we will talk about chronic cough. And I use the word chronic cough because on definition day, if you get cough where it don't be more than 2 months, they can't say chronic cough. You also get acute cough when a cough where it don't be less than 3 weeks, or subacute cough when a cough where it don't be between 3 weeks and 2 months. I will divide this presentation on chronic cough in 2 parts. For part 1, we will talk about some of the conditions and diseases and where they make you forget chronic cough. And for part 2 and at the next video, we will talk about the treatment and measures and way if you use them for address the chronic cough. So why person they even cough? Cough this one now with body own mechanism where it use them for expel any foreign particles where enter for we windpipe. If it be dust, if it be foreign particles them like food, sometimes if it be even gas like chlorine gas, you know when you use bleach, when it be too strong. If it even be cold weather or hot weather, anything where it irritate with windpipe, if it make and will cough, and we will see some example them soon. More start by even looking at when we talk say windpipe, bookman they call and say airway. This airway they so it gets an upper airway and a lower airway. The upper airway they start from the nostrils, it go to the back of the throat, and then you get some cavities the way they inside the bone them for face where they call and say sinuses. That cavity it continue the path they continue, and the nostril own path they continue the meter for back throat, and then it continue go down up to for way around where you get the vocal cord to voice box. This area so upwards they call and say upper airway, and I'll put some pictures then for here more na see them. They saw that airway they continue for down. So they go end for lungs them. That one they call and say, that part they call and say lower airway. And I go put pictures and more and see them. More also look at which way it happen, where they make a person cough. If you get some foreign particle or mucus or anything where it can irritate your windpipe, which way they happen, I say, you get some gate man them where they did for that lining of the airway, the windpipe, where it go, then they call and say, bookman, they call and say receptors. When any particles or anything where that windpipe no like them, it come for that airway. That gate man, they say, it go send some. Then some signal, then they go send them to the brain. And then when that signal go to the brain, it will go for the center for breathing, for the brain, the respiratory center. Then that respiratory center now it goes send some signal then back down to the muscles of respiration. Where that muscle of respiration they just did not like now soldier them. So it go now tell that muscle then say we did so when I get for activate. Where bookman call and say contract. One of that muscle then a diaphragm, the breathing muscle way there around here, it go activate together with muscles then for rib cage and some other muscles them around the vocal cords. They go all activate now, and then they go now contract and then expel, make you now cough, because when you cough so now you try now for push out that foreign particle where you don't invade your windpipe. More look at some of the things and way they feel cause this chronic cough. Number 1, now some condition they call and say upper airway cough syndrome or postnasal drip. What did it happen for this postnasal drip now say you did get inflammation of this upper airway starting from your nostrils, and even for that cavities and what I talk for your bones and for your face where they call and say sinuses. If you get any inflammation, anything where it cause inflammation for that area, if it even be dust, if it be environmental things and like say if you get grass outside way or flower where they bloom, or certain seasons them, even some people them they will just find themselves say they just be allergic to things them around them. So certain things then for environment, if you make them, you get that drainage where you go feel them in the back of your throat and then provoke you now for the cough. It is so if na allergies them for environment, or sometimes even certain foods them, if it make you be when you chop and you start get drainage too, if you be say maybe you be allergic even to that particular food. If na allergies that they cause you forget that drainage, bookman they call that condition say allergic rhinitis. Wetin be some of the things and way if it make you suspect say this one are allergies them, it make their drainage for the back of your throat. You feel the sneeze also. You feel get itchy eyes. You feel get itchy throat. When you get those symptoms and too, then suspect say na environmental allergies them, or maybe you don't come in contact with something where it make you forget allergic reaction to that particular substance. If you be say you go see doctor and they look in the back of your throat, or if you open your mouth even look for mirror of in the back of your throat, you go even see how it red. You go see how that area just be red, and picture then this way it will show you how it go look like. That one too na indication say you get drainage where it cause inflammation in the back of your throat and be responsible for your coughing. Some people then too, they go get hoarseness. Their voice go just change because of that drainage. Sometimes also, some people then where the drainage involve their sinuses. That cavities, they what I say they for bones and for your face. They go also sometimes even feel pain, like say they get heaviness. You know, like some people don't even say they feel like say their head ache. When if you get a lot of mucus where it don't build up for that sinuses. An example that way I will put them for up more na see am. So more talk about the second condition where if it cause you to get this chronic cough. Gastroesophageal reflux disease. Short form na GERD. Wait till way this long word it mean. It just means say you get food particles and or acid where it the reflux from your stomach come to your food pipe. So it is so our food pipe where they call and say esophagus. It is right behind the windpipe. And so that food pipe, the continuous, so it go down, it go into the stomach. And you get some muscle where it pass for day and then it go into the stomach. So when you get either acid from the stomach or food particles where it come up for that food pipe, it come for the back of the throat, if it cause inflammation and irritation, and it go make you cough. Sometimes it is so way, if it be say that stomach, it actually herniate, meaning say part of that stomach, it come up into the chest wall, where I will show on a picture for up here. If it come into that chest wall because it get some weak, that diaphragm, that respiratory muscles be weak, and the part of the stomach don't come up, that food content and acid, if it easily come up for your food pipe and come to the back of the throat and cause you for a cough. What will be some of the symptoms and where you go also get and where you go make you suspect say this, so maybe this my coughing now from that acid reflux or GERD. You feel for morning time, so you wake up, you feel like acid taste or even from funny taste for your mouth. Some people then they'll get really bad breath. Sometimes if you get hoarseness too, because you get that drainage where they come to the back of your throat and then go cause inflammation for your vocal cord. Your coughing feel worse when you lay down. So sometimes some people will tell you say when they lay down, they cough worse. In fact, with that postnasal drip too, if you be say you lay down and you feel like say you drown from drainage, if it also cause you for cough when you lay down. But acid reflux too go do them. When you lay down, you know that acid easily go to the back of your throat and then it go make you cough. For some people, them the acid reflux, if it cause soreness and erosions in the back of their throat, so they will get sore throat. Some people them actually even get erosions them for their teeth them, and I'll put some picture them for up more and see what way the sore throat, how it make person in throat look like, the redness way you feel see because of the acid reflux, and also picture for see how that acid, if it cause erosion for person, it teeth them. It is so certain conditions if it make you be more at risk for get this acid reflux. Obesity, so if you really be big, if it put you at risk. Pregnancy too, if you do, and when person be pregnant, it be more at risk for get that acid reflux. Certain foods them feed one, especially spicy foods them. Alcohol also, if you do one. Cigarettes, if you do one. Caffeine, chocolate, certain medications them. And even that hiatal hernia, what I talk say, what I don't describe an earlier way, part of your stomach, it dey inside your chest wall. If it cause you also for be at risk for get this acid reflux. These foods them and these substances that I don't mention, and it go cause relaxation for that muscle where it dey at the lower portion of that windpipe, that food pipe where they call and say esophagus, where that lower portion where they go into the stomach. So anything where you relax them, it go make you be more at risk for get this acid reflux. What will be the third condition where if it cause you for cough? Asthma. In fact, some people then get what they call and say cough variant asthma, meaning that their own main symptom for asthma are coughing, because asthma they so if it cause some people then for wheeze, for get chest tightness, and for cough. So for people there they get coughing because they get asthma where it not be controlled. They feel also get this chronic cough, and until you treat them, you will continue for the cough. And some of the things that way if it provoke you for start cough, when will provoke your asthma them, now also environmental things them. If it be dust, some people then weather change, if it be very hot weather or cold weather, some people then they be allergic to animals and like cats or dogs. Sometimes if you be allergic to the environmental flowers them where they bloom. Sometimes some people their symptoms go be worse during certain seasons, and where you get trees and where it get flowers where they bloom. And so anything where if it cause the asthma symptom them, especially the cough, it will also make you cough. What will be the fourth thing where if you make you cough? Forget this chronic cough. Medications. So some particular medications and the way they belong to a class called angiotensin converting enzyme inhibitors. Now a mouthful, but these medications them they use them for blood pressure and for heart, and they generally end with pril. I'll put for OBMO and see example them for different medications, and so that we now know if we for the medication them. But example then if it be enalapril, lisinopril, captopril, quinapril. So when you get medication where end with that name pril, suspect say maybe in that medication they cause your cough, and then you go see a doctor, make he see if he give you different medication for control your blood pressure. So for the part one, we don't talk about some of the conditions and way if it cause you for cough. For part two, we will talk more about what will be the treatment them and the things that we'll get for do them for help we for address this chronic cough. When I share this video with one of our friends, families, if you be a healthcare provider with your patients them, you feel it save somebody or help somebody where you get this condition. When I also subscribe and encourage others to do the same. Remember, knowledge is power and health is wealth. Thank you very much. Dr. Brownhilda Santo.